Hey guys, welcome to our lesson on ethics in advanced pre-hospital care, or ethics in paramedicine. There are a number of topics that we're going to discuss as we go through this lesson. And one of the things that you need to keep in the back of your mind is how complex ethics really are. There's been a number of events recently in the news that have brought a lot of highlights to public safety personnel and ethical decisions, and so it's important for us to be able to reflect upon what that might mean. Topics will include for today an overview of ethics and what that entails, along with ethical issues that the paramedic may face in the field in today's condition. I want you to anticipate a scenario here. I'm going to go ahead and read it. It's right from your textbook here, but I'm going to go ahead and read it shortly so you can see if you can get an idea of the importance of it. It says, consider the following. A physician administers 15 milligrams of intravenous morphine to a dying patient to alleviate their pain and suffering. That's one case. 15 milligrams of morphine is a lot of morphine. In another case, a physician administers 15 milligrams of morphine to a patient who is dying, in essence, to end that patient's life. Both physicians are giving the same medication, both physicians are giving the same dose for the same patient for the same complaint, but for different reasons. That brings us to the crossroads of ethics. Ethical situations and the process of utilizing ethics and understanding the legal issues that go along with that in medicine are extremely complex. We must begin to really reflect on our practices as care providers to determine how effectively are we making the best decisions for our patient. Are we truly being a patient advocate as we deal with both the legal, the ethical, and the medical issues that we see in the field? One of the things that I thought was interesting that your textbook talks about is a survey that, in essence, exposed that 15% of ALS calls in an urban system will generate ethical conflict. Another survey, EMS providers reported frequent ethical problems related to patient refusals, hospital destination, and advance directives. Those are all situations that become very sticky for us to manage, and oftentimes we have to make decisions based on little information without oftentimes enough consult. We'll talk more about that as we go through. When we think about ethics, we have to remember that ethics are very, very similar to morals. If we were to define those two, we know that they're so closely related concepts, but at the same time they're very, very different. So we have to explore each one. Morals is based on social or religious or personal standards of some type of right or wrong, right? The understanding of that you as an individual are guided based on your morals. It could be based on your upbringing. It could be based on your religious beliefs or just your own personal moral compass, making the right decision when no one else is looking. Ethics are a little bit different. Ethics are the rules or standards that govern the conduct of members of a particular group or profession, right? We have a code of ethics that we adhere to in EMS, to do no harm. Those components are different. Morals are what guide us. Ethics are the rules that give us the bumper rails, if you will, of how to be able to navigate correctly in a particular group or profession. When we think about ethics, one of the things that I think is extremely important is we have to begin to think about this question of what is right, what is virtue, and what are our beliefs and actions that we hold dear. Aristotle argues that the correct approach in studying such controversial subjects as ethics or politics, which involves discussing what is true, what is beautiful, or just. It is to start with that, right, and to begin to roughly agree to be true to people, to be good to people, and that people are of good being and upbringing, and that with experiences in life and to work that we must have some higher level of understanding. And that's pretty deep concepts. But one of the things that we look at with Aristotle is his Aristotelic beliefs, or Aristotelic ethics model that he utilizes, which is really about making virtuous character possible, right? Making sure that we do the right thing, again, when no one is looking, which is in turn necessary if happiness is to be possible. That's one of the things that Aristotle really takes a look at, is associating happiness to a righteous set of morals or virtue. Happiness is obviously the goal. In order to reach that goal, there's going to have to be a lot of steps and processes to get to that righteous behavior. And primarily, we think of it as promoting the development of those right habits. And that's where your education comes in play, because we need to make sure that we provide you with that. We also have to recognize that education doesn't do everything for involving what standards are appropriate. Character, habits, those components are also extremely important. Our character is created based on our ethics and our morals. And it's our ability to make those values habits, because good habits reinforce good actions. Aristotle states, we are what we repeatedly do. Excellent, then, is not an act, but a habit. And so we must understand that as we deal with Aristotle and this idea of what are ethics, he's going to argue that the correct approach in studying such of these controversial ethics, like we deal with the EMS or in the political system or even in the criminal justice system, we must look to what is beautiful or just and then do that repetitively, because excellent then becomes a habit, not just a random act. So hopefully that kind of motivates you as we start to go through this lecture. Relationships of ethics to law and religion. Ethics are not the same as laws. We know that based on the fact that there has been this idea, a long-term historical issue of between synthesis between what Aristotle was talking about and then Christian theology. This idea that became very widespread in Europe, and that we needed to have some idea of how to meet these, just define and meet these ethics, and religion came in as a component of that. Laws are much more narrowly focused than that of ethics. Ethics is a process, a thought process, a method to think about right and wrong. Laws are black and white. There's less leeway when it comes to that. Ethics looks at what is good, what is right, in the form of behavior. Now, we know that ethics must be understood and applied to people who hold a broad range of religious beliefs, or no religious beliefs at all for that matter. When we start thinking about this law of relationship between religion and ethics, just as ethics differs from the law, it also differs from religion. In a pluralistic society such as ours, ethics must be understood by and applied to people who hold a broad range of religious beliefs or no religious beliefs at all, right? So, thus, ethics cannot be derived from a single religion. It is true, however, that religion can enhance and enrich one's ethical principles and values. I go back to the statement, it's really doing the right thing when no one is looking, because it's the right thing to do. When we have to make ethical decisions, we have to think about what's referred to as ethical relativism. Ethical relativism is where each person must decide how to behave and whether that decision is okay or not. If that person makes the decision that it's okay or not, right? Just do what is right. We try to follow the golden rule, right? I've decided what I believe to be right, and I live by that belief. But what if I believe it is right to deny care to an individual that does not look like me? I believe that it's right to care for people who I only look like. What are my ethics in that situation? How are they going to differ from the profession's expectations for ethical management of our patient and my professionalism? Remember the golden rule. The golden rule may not even be enough to help us decide correctly. But what if I were to have done to myself would violate that belief, right? So this idea of the golden rule is do unto others as they would do unto you, right? Just do what is right. That oftentimes can be difficult in certain situations based on your morals or your upbringing or your religious beliefs oftentimes. Another one that we deal with here is the deontological method. It suggests that people should simply follow their duties, right? an example would be the Ten Commandments. The Ten Commandments provide a list of things to do, but do not necessarily give you guidelines on how to actually accomplish those rules, right? Thou shalt not take the God's name in vain, or the Lord's name in vain. Well, how do you do that? It doesn't really give you that specific information when it comes to that. Looking at them briefly, you can go through and kind of begin to decipher that, wow, these actually do give you some very specific guidelines, but not necessarily how to accomplish them. Consequentialism is a different form of ethical decision making. Consequentialism is the end result can be used to judge whether actions were right or not. The purpose of this action should be to bring the greatest happiness to the greatest number of people, right? Well, let's look at World War II with the Holocaust. What if World War II had been won by Nazi Germany? Would you find a Holocaust museum in DC? Or would you see a tribute to the artwork of a young Australian Adolf Hitler? History books are written by the winners. And so we have to remember that. And consequentialism is that basic concept that we only judge based on the actions that we know at the time. Who won the war? That determines what is correct or ethical at that point in time. There's, again, some context involved from point of view. Our code of ethics is extremely important to what we do, and the EMT code of ethics is there, in essence, for us to be able to focus on helping the most people, right? What is just and what is beautiful. Organizations have drafted code of ethics for members of their organization for forever. These codes address broad humanitarian concerns and professional etiquette. Few provide solid guidance on how to truly implement ethical problems or solutions to problems commonly faced by practitioners in the field. A code of ethics is a great slogan of what you're shooting for, but again, does not address how you actually get there. EMT Code of Ethics is here. You can go ahead and read it, and I'll post an image of this in our lesson as well. Now, the impacts on ethics in the individual practice, consistently displaying ethical behavior will gain the respect of colleagues and your patient. When you do the right thing for the right reason, people will notice. You may not always get a pat on the back, but when you do the right thing when no one is looking, you're benefiting your patient, you're benefiting your profession, and you are making an impact on that. Paramedics must understand, and here's the key, agree to abide by these responsibilities. Otherwise, how can we ever resolve any of the ethical issues or conflicts that we run across in the field, whether that be a death and dying situation, a transport decision, or even a DNR order? The fundamental question we have to ask ourselves is, what is in the patient's best interest? Let's take resuscitation issues at hand here. The answers are typically pretty obvious, but let's review some resuscitation issues. A paramedic must be very cautious in accepting a family's description of what the patient desires. We have to take in consideration also things like state laws, local laws, MCA policies regarding our patient resuscitation. The single most important question we must ask when we are faced with a potential ethical challenge is what's in the patient's best interest, right? Obvious answer, why they called is typically relief from pain or reassurance that the ill are going to be cared for, that they're going to have a prompt and safe transport to the hospital. Not obvious components might be things, what does the terminally ill patient want? What about when they go into cardiac arrest? What if those wishes don't align with what is documented for resuscitation? Do you resuscitate without knowing that they have a DNR order? Or do you follow their wishes? What happens if the patient revokes their DNR order just before dying? These ethical dilemmas really put a stress onto the provider. Some fundamental principles we have to identify here is beneficence. This is the principles of doing good for the patient. Non-malfeasance is the obligation not to harm the patient. We know that patients have autonomy, right? They have the ability to determine what happens to them. It's their right of what happens to their body. And then justice is obviously that we're shooting that all patients, and this is our obligation, but to treat all patients fairly. There is a model for ethical decision making that your book talks about, and it is relevant. It talks about regarding identifying the problem and lists the potential actions that you can take. Now, this is a process that's not meant to be immediate, right? There is a quicker approach to this, and we'll talk about that in a second. But in general, identify the problem and figure out what potential actions can be taken, right? Pick the best one and test that action. State it in a universal form, and then list the immediate and long-term implications of taking that action. Beyond that, you want to compare the implications with relevant values that exist. If the implications are inconsistent with relevant values, then reject that action. If implications are consistent with relevant actions or values, then conclude that those actions, at least provisionally, are considered to be ethically valid. It doesn't mean that you can't change your mind later on based on new information, but it's this idea that we're going to go through this process and say, yes, it is valid. If it's not valid, we're going to test other actions. We're going to try new ideas. And if no ethical pathway is considered valid, reconsider and test again. Start over from the beginning and make another valid choice, test that hypothesis. That's a great process, but I can tell you folks, it's not going to be something you can do on scene. There are, however, things you can do. Now, when you have ethical conflicts, as we know, ethical problems arise. Do we have a rule or a policy for dealing with that problem? That's one of the things that we will always want to consider first. Or can we reasonably extend a rule that's already existing or existing policy and apply it to that situation? If yes, well, follow it as noted, right? If no, then ask yourself some questions. Is there time to consider a solution without significant risk or harm to the patient? If yes, determine an acceptable solution. If no, apply one of the following. This may be an partiality test, a universal ability test, or interpersonal justifiability test. We'll talk more about what those mean shortly. Long story short, the paramedic needs to have a system for resolving ethical conflicts. This is an example that you could use that will help you be applying it quickly. We talked about resolving ethical conflicts and used some of these terms of impartiality, universality, that's a hard one to say. But with an impartiality test, would you be willing to undergo this procedure or action? Would you do this to yourself? Very similar to that golden rule, do unto others as they do unto you. Would you want to go down that same avenue if you were the patient? It helps to reduce any possibility of bias that may exist. Universality, this is where you would want this action performed in all relatively similar circumstances, right? Think of something to deal with pediatric patients, or if abuse or neglect, right? We would want this action to be performed similarly in all circumstances. Interpersonal justifiability is where you can defend or justify your actions to others. Oftentimes we use this as a coping mechanism or a defense mechanism to support our morals. The paramedic should consider whether other people think that action will be reasonable. Not just if you can justify it, but would others with similar training and a similar scope of practice or standard of care, would they understand and agree with your actions, your interventions, your decisions? That oftentimes can help in the resolving of ethical conflicts. Now let's switch gears a little bit and let's talk about some of the more common issues we see in contemporary paramedic practice. There's a number of these, and we'll go through each one individually, but some of the big ones that stand out to you is resuscitation attempts, patient confidentiality, obtaining consent, allocation of your resources. What do you do when it's a mass casualty and you have to make ethical decisions if someone lives or dies? Obligation to provide care to a patient or to withhold care. We've got ethical issues when it comes to educating our future providers, professional relations, and then even research is impacted by ethical issues, and we'll dive into each one of those. One of the biggest ones we see in the field is resuscitation attempts. You need to know your rules and regulations. You need to know your protocols when it comes to do not resuscitate orders. The patient is still entitled to reasonable measures intended to make them more comfortable. Just because someone has a DNR, that does not mean do not treat. means do not resuscitate. If they're alive and well, or alive at the least, you'll want to provide care based on the patient's wishes, right? And hopefully that's been clearly communicated between you and the patient. When in doubt, perform resuscitation. It's always going to be your best bet is to try to provide emergency resuscitative care when you can't necessarily see that. Confidentiality, your obligation to every patient is to maintain confidentiality as much as possible. We don't share information regardless of that, and that truly helps us get information as a result of your participation in a medical situation, right? Reporting certain information like child abuse or neglect or elder abuse are exceptions to this. There are exceptions to when we don't say things, but we know with HIPAA, we know that keeping our patients' information private and confidential allows them to open up to us more, for us to really gain more information as we build and gain that trust. Consent, obviously, right? We know that patients have autonomy. They have the ability to decide what's best for themselves. Here's a situation. How about a patient who's having an apparent myocardial infarction, and yet, even though that you've explained to them that they're having a massive MI, they are refusing care after all of your efforts. You, the family, medical control, none of them have successfully changed the mind of that patient when it comes to transport. They refuse to go to the hospital. What do? AMA? That's the technical policy procedure. But what happens if you clear and then 5 minutes later the patient codes? We have to try to do what was best for our patient. And again, recognize that patients have autonomy. Patients have the right to live. Patients have the right to die. Now, when we think about consent, in order for you to provide patient consent, the patient must have 3 of the following things. Here's what we're looking at. They have to have the information necessary to make an informed decision. That means if they're going to die from this, we need to tell them that in very raw terms. They must be completely informed of all of the options that they have, right? Because we need to make sure that they can weigh the risks and benefits based on their own beliefs. We also have to know that that patient has to have a mentally a competent patient in order for them to be able to recognize the benefits of the treatments that you're offering, right? They have to be a sound mind in order to be able to go down that avenue. We also have to recognize that they have to have freedom from restraints that might hamper a patient's ability to exercise their options. So consent is based on a person who's of sound mind, a person who understands what's going on, that they're informed, and that they have the ability to freely choose based on the informed consent and their ability to have proper mental faculties. Allocation of resources. In this, you are attempting to do the best you can with what you have available. Beneficence is exactly what that is. There's a lot of approaches to consider with this. All patients could receive the same amount of attention. Patients could receive resources based on need. Patients could receive what someone has determined that they've earned, right? Well, we have to recognize that in medicine, when the needs of the many outweigh the needs of the few, there's your Star Trek quote from me, from Mr. Spock, we've got to be able to make big decisions that are going to have impacts on a lot of people. And triage is a prime example of this, where we have to make life and death decisions of walking away from a child who's in cardiac arrest during an MCI because we don't have the resources to dedicate to them. Again, remember, the needs of the many must outweigh the needs of the few. An obligation to provide care. The paramedic has a responsibility to help others, right? You have a duty. You're obligated to provide care without regard to the patient's ability to pay or any other criteria. They call, you are going to help. We don't do this thing of, do you have insurance? Well, no, then I'm sorry, you're going to have to die. We're leaving. We need to make sure that we try them, right? We also have to have a strong ethical obligation to help others, even when we're off duty. Think about this. You're off duty, you're on vacation in another state, and you see someone who needs help. You have no equipment. What do? Do you help that patient? Do you not help that patient? Apply morals, apply ethics, to that situation? What would someone else do in your shoes? What would they want done to them as you would want done to you? Most likely you're going to want to provide that care. Another thing that we have an obligation to is we've got to recognize that patient dumping does occur, right? Patient dumping is where you just take the patient to a local hospital and get rid of them because you don't want to have an obligation to them. You don't want to have to worry about them. We see that a lot. Patient dumping is not appropriate, obviously, and here's why. There's a rule called EMTALA, and EMTALA requires most hospitals receiving payment from the Department of Health and Human Services, Medicare, Medicaid, government funding, to provide an examination and needs of stabilizing treatment, providing emergency treatment without consideration if that individual has insurance coverage or the ability to pay. When a patient presents to an emergency room for attention to an emergency medical condition, there is no reimbursement provisions that have to be in place, and participating hospitals may only transfer or discharge patient needing emergency treatment under their own informed consent after stabilization or when their condition requires a transfer to a hospital better equipped to administer that treatment. The idea behind this is we don't want to just go and drop our patients off. We can, because we know that that's EMTALA allows for that to occur. We can take the patient there and the patient must be seen. We also have to make good decisions for our patients of where they need to go. These things apply virtually to all hospitals. The only hospital that has an exemption of EMTALA is the Shriners Hospital for Children's, the Indian Health Services Hospital, and VA hospitals. EMTALA provisions apply to all patients, and not just those that are funded by Medicare or Medicaid. When we think about teaching, students are caring for patients, right? And you're working with the students. Put you on a truck, and you're now a seasoned paramedic, and you have a brand new paramedic from Colorado Community College that's popping out to work with you. You get a patient. It's your first call. You walk in and you say, "I want you to go ahead and take this call. I want you to go ahead and perform this procedure, this IV." Should patients be informed that a student is working on them? If the patient doesn't know that a student is working on them, that poses a problem, especially when an error can occur. Patients have to be informed, right? System runs the risk of being accused of concealing important information from patients. I can tell you, if I were to go to the hospital and have a student show up, one of my students even for that matter show up, I'm going to have concerns about them working on me. Not because I don't trust your skills, but because I have my privacy. But that's an important thing, that patients have that autonomy to make those decisions. And they have to be based on competencies, right? Is that student safe to do that skill? How many attempts are you going to allow a student to perform an intervention like an IV before you say, no, that's enough? You got to think about those things as you're becoming a paramedic. How are you going to help foster that next level of EMS provider? We also know that professional relations is extremely important in our industry. The paramedic answers to a lot of people, to the patient, to the physician, to the medical director, to their employer, and sometimes during these processes, conflicts are going to arise out of these relationships. Ask yourself this: do you always agree with your coworkers? Are you always agreeing with what healthcare organizations are doing, or what your profession is looking at, or the direction that they're headed? If you're given an inappropriate medication order, for example, give 5 milligrams of dopamine. That is not a right dose. After that order is given, do you have a responsibility to correct that physician and help maintain that relationship? What do you do? Physician conflicts, typically, physician is going to order something and then the paramedic believes that it's contraindicated, right? The paramedic believes that an order is medically acceptable, not in the patient's best interests. And so it could be something like the physician orders something the paramedic believes is medically acceptable but morally wrong. What do you do in those circumstances? When we think about resolving physician conflict issues, best way to improve conflict is through effective communication. Confirm the order. Ask the physician to repeat it. Ask the physician for an explanation of why it's important. We're consulting here. We're working as a team to ensure that our patient gets the best treatment possible. At the end of the day, You must make the decision as a paramedic of what is in the best interest of your patient because you are there with them. Remember, there are protocols to break protocols. And again, if you're shooting for what's the patient's best interest and keeping that at the forefront of what you do, you're going to be on the right side. We know that research is extremely important in today's environment, right? The goal of research is to help us ensure that what we know today, we learn from tomorrow, right? That what we learn today, we can apply to making things better in the future moving forward, right? It's important that we have specific knowledge about our specific interventions, that we know what we need to know to do our job. It's important to gain informed consent. Research has told us that at the end of the day, if we don't get consent, it's very difficult for us to get enough information about new procedures or even to gather that information because those patients have private medical records and we need to utilize that data. Patient who's unable to consent, the federal government has strict rules about community notification before a study begins. So even in research, there's going to be ethical decisions. A prime example of research that would create an ethical conundrum. Your medical director wants to determine if the use of epinephrine in the pre-hospital setting for cardiac arrest, out-of-hospital cardiac arrest, increases or decreases survivability. And as a basis of their research plan, they plan to have each ambulance randomly assigned drug bags. And in those drug bags, you will have situations where there will be no epinephrine and times where there will be. And the paramedics will not know until they get there. They'll open the bag and they'll say, this is going to be a research study. We want you to use X drug instead of it. Maybe it's a vasodilator instead of a pressor agent, or maybe it's the absence of epi compared to using it. It's going to be randomized. But you have to recognize that that's not the standard of care, and because it deviates from that, the patients must be informed and there must be consent administered in those circumstances. And so there's a lot more we could talk about that, but I'm going to leave it there for right now when it comes to research. Just know that ethics is going to touch a number of processes and process. In summary, we know that ethics is really learning to do the right thing when no one is looking, and it is guided by our internal moral compass, or our morals. We know that there's a lot of ethical issues from resuscitation to research to confidentiality to consent, all these components that come about as you're becoming a paramedic. And so as you move the rest of this semester and you begin to establish your internship and begin to truly have an impact on patient care directly, I want you to make sure that you're thinking about ethics daily. Are you putting the patient's best interests at hand? And are you making the right decision when no one else is looking? Because it's the right thing to do, because it is professionally or morally ethical. And so with that will conclude our ethics lecture, and I'll catch you on the next lesson.